Hello everyone, I'm Dr. Nisha Bhatnagar, Medical Director at Aveya Fertility and IVF Center. Welcome to our YouTube Academy. So today I'm going to talk about a very important procedure, that is embryo transfer. Trust me, it is make or break of the IVF cycle. So what is embryo transfer? How it is done? What are the nitty-gritties of embryo transfer? What you have to take in mind, what you have to keep in mind? We will be talking about that today. Embryo transfer is a very delicate process where the embryos which are cultured in the lab till day 3 or day 5 are transferred back into the mother's womb. So when we take the eggs out, we select the mature one, we put the sperm inside the egg and culture it to day 3 or day 5. Depending upon the number, depending upon the lab, some labs prefer to transfer day 3 only, some lab prefer to do day 5 like we do in Aveya. We do only day 5 embryo transfers. Even if it is a single egg, we prefer to take it to day 5 because if it reaches to day 5 in the lab, there is a higher chances of giving it a pregnancy to you in the womb. So time is of utmost importance here. You need to understand that if you have going for a day 3 transfer, you need to take at least 3 days of progesterone at 6 doses. If you are going for a day 5 transfer, you need to take 5 doses of progesterone, that means 10 doses. You are called on the day of embryo transfer, you are informed about the embryo transfer, no need of any fasting or anything, you have your own breakfast and everything. The only thing you need to do is drink enough water so that you have a bladder full. The importance of full bladder is for us to see the uterine cavity properly. There is no other importance. Some people are worried that if I am not having bladder full or if I just pass the urine after embryo transfer, the embryo may fall out. No, that's not the case. The embryos is a teeny tiny structure. It's microscopic structure. You cannot see it with the naked eye. Once you put it back in the uterus, it stays in the uterus. The only thing is whether it implants or not implants. That depends upon multiple things. Endometrium lining, triple appearance, thickness, vascularity, the blood flow, all those things help in implantation of the embryo. I'll give you a little brief about the procedure. So these are simple catheters which we use for doing a embryo transfer. There are two parts of this catheter, one is called the outer and another is called the inner. So if you can see this clearly, this is the outer, maybe you can see it clearly here, this is a embryo outer, and we insert this outer till the internal os, the internal mouth of the uterus. We insert this outer till there, then the embryologist loads the embryo in this small thread like structure. You see how thin this is? Very thin. So the embryologist loads it into this and we slowly put it inside like this and deposit it inside the uterus. You see it is a little 1.5 to 2 centimeter beyond the outer. So the embryos are loaded here and when we push it back, the embryo stays in the uterine cavity. This is a very thin thread like structure. It is not painful at all. Sometimes the cavity, it is maybe difficult to insert it because of the position or the fibroids or something. So we have a little, it's a very soft structure, but sometimes we need a little push to happen because the cavity is difficult to reach or fibroids are there. So we have this another type of catheter where we have this stellate which helps in inserting the catheter inside. It goes easily. Either of these catheter, none is painful. It's not a painful process. Rather, it is the most delicate process out of the whole cycle. Now, what the success depends upon? Success depends upon many things, like for example, optimal conditions, like I already talked about the lining and all, about the grade of the embryo. If the grade of the embryo is good, if it is a day 3 embryo, grade A, grade B, grade C. Grade A means it's a 8-cell embryo, all cells are equal and the fragmentation is less than 5%. Grade C means that the cells are fragmented, they are unequal and there are less than 6 cells on day 3. Then we usually transfer blastocyst. The blastocyst, the grading starts from 5AA and till 3BB. 5A is considered best and it gives you a 65% success rate. 3BB is the least, which gives you a success rate of around 45%. But trust me, with 45% also it means that 45 people out of 100 are gonna get pregnant with this transfer. So it's all you are either in this 45% or the remaining. Nobody can tell you beforehand where you belong. So the only thing you can do to increase your chances of success is stay calm and relax. The grading is a very individual thing. The embryologist grades it. 5A means 5 means it's fully expanded. A means the inner cellular mass is very good. It's gonna form a baby. Second A means that the trophoectoderm, the placental layer is very good and it is gonna form the placenta. Now there are various instruments also available, like for example embryoscope or time lapse, which tells you about, it takes sequential pictures of the embryo and gives you a grading that this embryo is gonna perform the best. But it is not a very necessary equipment. Now to enhance the success rate, there are things like PGTA, genetic testing of the embryo, which can tell you which embryo is aneuploid, means there is any chromosomal problem in the embryo, or which embryo is euploid, means it is genetically normal. A genetically normal embryo has a higher chance of success, whereas the aneuploid embryo has higher chance of miscarriage. So if genetically testing is not recommended in the first go, if you have had multiple transfers, recurrent implantation failure or recurrent pregnancy loss, or there is any indication like some genetic abnormality in the family, or the mother is of advanced age, for example more than 37 years of age, then genetic testing is recommended, otherwise not. One more thing important is the number of embryos to be transferred. This should be discussed with your doctor beforehand, before you go for the transfer. And recommended is single embryo transfer if it is a day 5 embryo, 2 or 3 day 3 embryos transfer. You should never go more than 1 or 2 blastocysts or 2 or 3 day 3 embryos. But again you have to discuss with your doctor, depending upon the grade of the embryo, depending upon your age, depending upon your reason of infertility, depending upon the number of embryos formed, depending upon your endometrium, that how many embryos you want to transfer. I personally recommend single day 5 blastocyst transfer because it has a maximum chances of success with minimum chances of complications. Twins sounds very good, you know, it looks very good that you're gonna have 2 children in one go, but it is a very difficult journey. It leads to many problems: preterm delivery, eclampsia, PIH, blood pressure high, prematurity of the twins, keeping the babies in the NICU, the baby born weak, IUGR. There are multiple things which are associated with multiple pregnancy. So recommended is single embryo transfer. In short, this is a very easy process. No need of any fasting. It's not a surgical process. You don't feel anything. It is the gentlest procedure possible. You just have to come with full bladder, having your own meal, breakfast and everything. No role of bed rest after that. You can rest for 10-15 minutes, but then you have to be as normal as possible. Number of embryos transfer to be discussed beforehand, and please take all your medications afterwards as advised by the doctor. Nowadays we do natural cycle embryo transfer, where the number of medications and the dose of medication required is almost negligible. If you have any more questions about it, please feel free to contact us at given numbers.